Hello, I'm Dr. Ahmad Hegazy, a neurology specialist in the Neurospinal Hospital with more than 20 years experience in the different neurological disorders management, including stroke, Parkinsonism, involuntary movement, epilepsy, MS, headaches, and other issues. Today we will talk about a very common and most prevalent disease neurologically all over the world. That is headache. In brief, we can categorize two types of headache, primary and secondary. Primary means without an organic brain focal lesion. Secondary, there should be a focal brain lesion. Among the primary types of headache, the most common cause is migraine. A widespread complaint all over the different clinics or the different specialties. Migraine affects mild-aged adults, especially in females, more than males, and it can present in different ways. There is common migraine and there is typical migraine. Typical migraine usually comes in one side, we call it hemicranial, usually pulsating in nature, usually associated with nausea or vomiting, photophobia or phonophobia. In most of the cases, it is familial. You will find positive family history of similar patients with the same type of headache. That is even considered one of the diagnostic criteria of migraine. Also, it is common in females, especially when they are on hormonal therapy, like contraceptive pills. Also, there is a very common type of migraine in females called catamenial migraine. Usually occurs around the time of the menses, 2 days before or during the menses or 2 days after. The crucial diagnosis of these types of headache is the history of the patient. For example, when the patient is suffering headache only on Friday or the off day, and he is usually drinking coffee regularly at work, this is withdrawal due to caffeine withdrawal. Patient taking contraceptive pills usually develop a migraine with increased intracranial tension. There is a common migraine even in children, especially if they have one of the parents or both parents with migraine, to the extent that when a son has a father with migraine, he has a chance of 50% to develop migraine. And if both parents have a history of migraine, the chance going up to even 75% to have migraine. Migraine and our headache in general in children should be taken cautiously because there is serious other etiologies like intracranial brain tumors, especially in the posterior fossa, and should be dealt with cautious and doing MRI brain as possible as early. In the old age also, when they have recent onset headache, it should be taken seriously because there may be underlying brain tumor like meningioma, glioma, something like that. Not like patients with a stereotyped headache for years. This is something reassuring, and it is not always underlined by focal brain lesions. There is a unique form of migraine also. It's called post-traumatic headache. It usually occurs after head trauma, after a week, and can last more than 3 months with unclear etiology. But we have to rule any other sequences of trauma. There is a unique form of visual manifestations with migraine, usually preceding the onset of the headache. An interesting one of these is called visual snow manifestations. The patient, as if he is seeing an television with dots after the end of the broadcasting, and it is bilateral and it lasts for 3 months, and it affects both the fields of vision. And the etiology could be due to migraine. Good news now for these days, there is a lot of recent medications to control migraine. Unlike the people say migraine has no treatment, this is a new era of a specific medication for treatment of migraine, even in the acute phase and for prophylaxis. For the acute phase, we have a lot of medications with oral medications and intramuscular. There is also subcutaneous. There is IV medication. There is even nasal drops and eye drops. All are acting with a good result, unlike before. Thank you.